We provide mentorship. The clinical leads are both trainers, so we support colleagues.
Within our working week, we have an open door policy, and so a lot of the training occurs through clinical encounters.
This practice has been here for many years. We took over the contract in April 2015. The practice currently has roughly 7,000 patients and has a wide-ranging number of staff with different roles. We have at the moment 3 full-time GPs who happen to be all female. We have a couple of clinical pharmacists. We have a number of nurse practitioners and nurses and healthcare assistants to help us to deliver the service. The practice is based in the north of Solihull. Solihull in itself is a relatively affluent area. The schools are excellent. The commute is relatively easy in the mornings throughout Solihull. We sit on the ring road of the M6 and the M42, so a lot of colleagues find that actually getting into work is relatively straightforward.
What we've tried to look at the practice is how we can make our day-to-day work for our clinicians as seamless and as efficient as possible. Rather than bringing somebody back for their diabetes and back for their asthma and back for various individual conditions, we like to kind of think that we can offer longer appointment times to actually re-allow our clinicians to get down to helping the patient as part of an all-round holistic care.
CPD is promoted by way of allowing new recruits and GPs to gain a vast experience in management, if that's what they're interested in. We also encourage GPs to develop new skills for services that they can deliver in the practice, and we pay for training for that to happen.
Training is a huge part of what we offer here. Within our working week, we have an open door policy, and so generally the day-to-day, a lot of the day-to-day training occurs through clinical encounters and discussing cases, for example, with each other.
We encourage GPs to develop portfolios to become clinical leads. We provide mentorship. We're training. We're both the clinical leads are both trainers, so we support colleagues who are just coming out of training into general practice and the new environment. We also provide tier 2 visas, so we can support colleagues who need visa status changing to work at the practice. By far and away, the most important to me is that you've got an excellent team of supportive staff around you. We've worked hard not just with clinical staff but with also administrative staff to ensure that the workload for the GP is focused and concise. We have flexible working for staff so that we can fit around term time, school time, late morning starts, etc. And we have a training mantra, so we support staff in self-development.
Kingshurst Medical Practice is part of a wider organisation by the name of IntraHealth, who have a total of 5 practices within the West Midlands. Now, what we'd like to kind of put across to any new member of staff, whether they be a GP or any clinical health professional, is that we give the opportunity for people to either work closely within a set practice, so somebody coming to join us at Kingshurst would be allowed to develop and work alongside the rest of our clinical and non-clinical team to help better the local community. But we do offer the opportunity for those clinicians who would like to kind of get involved with the wider running of the organisation to get involved with IntraHealth locally within the West Midlands.